Welcome to the PlantFit Summit, bringing you the best in plant-based health and fitness. This is Luke and Toby, and today we have Dr. Michael Greger. Dr. Greger is a physician, New York Times best-selling author, and internationally recognized speaker on nutrition, food, safety, and public health issues. Dr. Greger is a founding member and fellow of the American College of Lifestyle Medicine. He's also licensed as a general practitioner specializing in clinical nutrition. We start the conversation with Dr. Greger sharing about what a pandemic is and why it exists today. Enjoy the presentation.
Demos means the people, and epidemos, epidemic, is upon the people. Pandemos means upon all the people. So it is a disease outbreak that is global in nature, and we've had pandemics ever since we've had, cross-continental travel. As soon as people could reach other continents, and we have the first opportunity for global pandemics. Actually, that killed off much of the inhabitants of the Western world was when smallpox landed at the shores of the Americas, as well as measles and tuberculosis. And the reason, you say, wait a second, why did European diseases wipe out the Native Americans instead of Native American diseases wiping out the Europeans? Because there were no epidemic diseases, because these diseases come from animals. And so there were buffalo, but no domesticated buffalo. So we didn't have to worry about measles. There was American camels were wiped out in the last ice age, so we had no smallpox. We didn't domesticate goats, so we had no tuberculosis. And so now it's really a matter of changing the way animals live, which is leading to a whole new slew of infectious disease threats.
That's fascinating. You already hinted to what the origins of many diseases are. Can you elaborate a bit further on origins of diseases and how can they jump from species to species?
Yeah, well, in recent years, over the last few decades, hundreds of human pathogens have emerged at a rate unheard of in human history. Emerged from where? From animals, right? So the AIDS virus is blamed on the butchering of primates in the bushmeat trade in Africa. SARS and COVID-19 have been traced back to the exotic wild animal trade. But our last pandemic, swine flu in 2009, arose not from some backwater wet market in Asia, but was largely made in the USA and industrial pig operations in the United States. Now, thankfully, swine flu only killed about 500,000 people, but the next time we might not be so lucky. It's devastating. As COVID-19 has been, it may just be a dress rehearsal for an even greater threat waiting in the wings of chickens, according to the CDC. The leading candidate for the next pandemic after COVID-19 is a bird flu virus by the name of H7N9, which is 100 times deadlier than COVID-19. So instead of a 0.4% case fatality rate, 1 in 250 people dying, we're talking about 40%. H7N9 has killed 40% of the people it's infected. The last time a bird flu virus jumped species directly to humans and triggered a pandemic, it caused the deadliest plague in human history. The 1918 pandemic, which killed 50 million people, that had a 2% death rate. Right? What if we had a pandemic infecting billions where death was closer to a flip of a coin? But the good news is there's something we can do about it. Just as eliminating the exotic animal trade and live animal markets may go a long way towards preventing the next coronavirus pandemic, reforming the way we raise animals for food may help forestall, raising domestic animals for food may help forestall the next killer flu.
Mm-hmm. Well, it's good to know that there is things we can do about it. You mentioned already that there is a link between handling animals and the exposure to those viruses. Does that mean also only people who are initially exposed or handling those animals are exposed or threatened, or can those viruses and bacteria or whatever travel with the food to everyday people as well?
Well, I mean, it doesn't matter what you eat because as soon as a pandemic jumps from food animals and travels person to person, then the risk really shifts from eating to breathing. But that's why, it matters how we raise animals around the world, regardless of what we eat, because we're all put at risk by animal agriculture in general. So the initial animal to human transmission would likely occur from a live animal, but then once it travels human to human, the animals really can be out of the picture.
So it sounds like the industry, especially farming animal industry, they have a big role to play in this. What's their response to the current developments and their responsibility in this?
Yeah, well, look, they realize that when we overcrowd thousands of animals in these cramped, filthy football field-sized sheds to beak to beak or snout to snout atop their own waste, it's just a breeding ground for disease. The sheer numbers, the overcrowding, the stress, crippling their immune systems, the ammonia from the decomposing waste burning their lungs, the lack of fresh air, lack of sunlight. Put all these factors together, and you really have kind of a perfect storm environment for the emergence and spread of so-called super strains of influenza. The bottom line is it's not worth risking the lives of millions of people for the sake of cheaper chicken. But unfortunately, money is what makes the world go round, and so we'll have to change our demand for such products such that the companies will do their part in shifting over. I mean, look what happened to the dairy industry. Have you seen a dairy case lately? All right, fluid milk sales have plummeted. Major dairies are going out of business. Why? Because you give consumers a constellation of new, better choices, and there you go. Let the market speak. And similarly, all the major meat producers, Tyson, Smithfield, Hormel, Purdue, JBS, right, have all started innovating us out of this precarious situation by making these plant-based meat alternatives. So, I mean, look, and we're not talking about Tofurkey here. Cargill is the largest private corporation in the United States, one of the biggest meat packers in the world. So they're coming out with these all plant-based, lines of sausages and, chicken nuggets, that kind of thing. So, I mean, if people eat them, if people demand these products, well, then they'll make more of it, and the world will be placed at less risk.
Mm-hmm. You mentioned super strands. What are those, and how do they develop? You already gave some indications to that, and are they the biggest risk for us?
Yeah, so influenza remains the biggest risk that we know of. It triggered the deadliest plague in history. It's one of the few pathogens known capable of infecting literally billions of people within a matter of months. In the last few decades, there's been emergence of these highly pathogenic, highly disease-causing strains. I mean, normally, people cannot get the flu from the original reservoir of influenza, which is waterfowl and shorebirds, and people do not get flu from ducks directly. But once we domesticated ducks and mixed them with terrestrial birds like chickens, these live bird markets, for example, when the virus finds itself in a gut of a chicken, it no longer has the luxury of easy waterborne spread. I mean, normally, influenza is a harmless intestinal, waterborne fecal oral virus of ducks. But in a chicken, chickens aren't paddling around in the pond, so it has to mutate or die. And that's what influenza viruses do best. They mutate and may find the lungs and become an airborne pathogen. It can, go into chickens as a harmless virus, come out as the flu, and travel and affect terrestrial mammals such as ourselves. So that's how they can become infectious. And the way it gains lethality is that you have transmission from a mobilized host. Normally, there's a cap on how dangerous, how deadly, how overwhelming these viruses can be because dead ducks don't fly, right? That's why if a virus kills you too quickly, it's actually not in the virus's best evolutionary interest to do so because it wants you to get out there, spread it around a little bit because the virus, basically, goes down with the ship. And so it wants to jump ship before you take it down with it. But when you have circumstances like the trenches in World War I, where you have people packed together and you could not escape a sick comrade, well, then the virus can ratchet up virulence because there's no limit to how deadly it can get. I mean, once a virus can, hit you like a 2x4 and still transmit to the next person just because you're so packed together, well, then there's no stopping the virus. I mean, so it's always in the evolutionary best interest the virus to try to overwhelm the immune system, but it doesn't want to get too deadly because then it won't spread. But if it can get deadly and spread, well, then go for it. And so that's what happened in the trenches of World War I. And from the virus's standpoint, we have those same trench warfare conditions today in every industrial egg operation, every industrial chicken shed, confined, crowded, stressed, but by the billions, not just millions.
Mm-hmm. Can the same be said about humans and the urban population, that we're closer together?
Well, certainly cities, the founding of these kind of mega cities, 10 million people and up, certainly makes spread, viruses can spread like wildfire, but it's really our global connectedness. And if there's a city that no one can get to, you don't have to worry about it. The biggest city in New Zealand is completely isolated from the virus, so you can't get the virus unless the virus can get to you. But in the age of global airline travel, a virus can basically get anywhere on Earth in 24 hours and escape our grasp. That's why we need to prevent the emergence of such viruses in the first place.
Mm-hmm. You already mentioned that viruses have different methods of traveling or going from host to host. So what are those different avenues that they can take? And is there certain viruses that only take one, or does it change over time as well?
Oh, there's lots of ways viruses can transmit from one to another. There are sexually transmitted viruses. There are bloodborne viruses, so sexually transmitted viruses like HIV, bloodborne viruses like Ebola and hepatitis B, hepatitis C. There are respiratory viruses like influenza and these coronaviruses that transmit largely, we think, through droplet transmission, but may indeed also be able to be aerosolized and linger in the air. We're not sure what percentage of transmission that is attributable to that kind of transmission. But from a pandemic standpoint, respiratory viruses are the most dangerous because they can so rapidly spread. HIV did kill 30 million people, but it took, 40 years to do so. Whereas you can kill 40 million people in a matter of months if you have a respiratory virus, like happened in 1918.
You mentioned already what we have to do as a society to protect ourselves in terms of the food system. But what can an individual do to protect themselves and maybe their families? Is it move to the Antarctic, or what's the option?
Oh, well, the only way to stop pandemic is what's called herd immunity, having a critical portion of the populace immune to the virus. An infection can only kind of burst through a population if there are enough susceptible individuals for the virus to jump from one person to the next. Immune individuals who can't get or transmit the virus act as fire breaks to slow the spread, or like control rods in a nuclear reactor to break the chains of transmission. Now, ideally, this is accomplished through mass vaccination. Vaccines are a way to fight fire with fire, using the virus to fight the virus by generating the benefits of infection immunity without the risks, disease, and death. Now, without a workable, available, safe vaccine, then herd immunity is only achieved the hard way through mass infection. But as I said, you can't get the virus unless the virus can get to you. And the most important thing is distancing. The coronavirus comes from other people. You stay away from other people, mask or not. The data on masks actually is not that great. And if anything, we're probably just protecting other people from ourselves rather than the other way around for most masks and cloth face coverings. And my concern is that by wearing masks, people have a false sense of security and get closer to people than they otherwise might. And you just want to be as far away from people as possible. Particularly critical is, confined, crowded indoor spaces for extended periods of time. That would be the riskiest scenario. Whereas if you're outdoors, then the risk is exceedingly low because the breeze can just kind of waft the virus away.
Now we see different outcomes. So there's people who struggle severely when they contract, in this case, COVID-19, and there's some where it doesn't seem to have much of an effect. Why are those differences so vast, and what are the factors that result in those different outcomes?
Yeah, well, consider the underlying risk factors, right, for COVID-19 severity and death: heart disease, hypertension, type 2 diabetes, obesity, all of which can be prevented, arrested, and reversed with a plant-based diet and lifestyle, right? Even excess body fat alone can be a risk factor. Those with even just being overweight, for example, at a BMI of 28, which is like 175 pounds of the average American height, puts you at nearly 6 times the odds of suffering a severe course. In the United States, the average BMI is 29. So you can be skinnier than the average American and still have so much excess body fat that you could be put at significantly higher risk. So we should really take this opportunity right now to, clean up our health, clean up our act, clean up our diets, start an exercise program, get better sleep, stress reduction, stay connected, albeit remotely, with friends and family. This is the time to take better care of yourself, and not only will it help you prevent, reduce risk right now from current infectious disease threat, eating a healthier diet will help you in the future towards chronic disease threats when this pandemic is history.
Do we understand the link between, let's take diabetes, heart disease, or any of those chronic diseases, and how does that contribute to a more severe development of a coronavirus infection?
Oh, that's a good question. Yeah, so take obesity, for example. The excess risk from excess body fat may arise from greater systemic inflammation. Obesity is you measure, inflammatory markers like C-reactive protein, and obese individuals have significantly higher levels. Fat actually covers the heart itself, called epicardial fat. So people have excess body fat around their bodies, also have excess body fat on their heart, and that may be playing a role producing these inflammatory markers. It's also something called obesity hypoventilation syndrome, which is just a physical restriction of breathing caused by having excessive fatty tissue in the upper body. So these are some of the reasons why, for example, excess body fat could so increase the risk of COVID-19.
Are there specific foods that you would recommend to keep us healthy, hopefully at the peak immune level?
There are amazing studies showing that simple foods can boost your immune system, like randomized, double-blind, placebo-controlled, showing that eating broccoli sprouts, for example, can significantly reduce viral loads from influenza, decrease virus-induced inflammation, and boost our antiviral natural killer cell activity, all from just eating broccoli. But this is not the flu, right? Unlike other common viruses, coronaviruses have not been shown to cause more severe disease in immunosuppressed individuals. Why? Because it's your own immune system that appears the main driver of lung tissue damage during infection. Starting around the second week of symptoms, the virus can trigger what's called a cytokine storm. It's like a kind of an autoimmune reaction where your body kind of overreacts, and in attacking coronavirus, your lungs gets caught in the crossfire and kind of burning down the village. In order to save it, we may not survive the process. So I certainly support general common sense advice to stay healthy during the coronavirus, like eating a healthy diet, but would not go out of my way to try to take any specific supplements or specific foods to boost elements of your immune system until we really understand more about the virus.
I think that's an important point that you bring up. The severity of viruses can vary widely between the common flu that we have every year and then something which is completely new and we don't understand yet. So if you were to compare viruses and their severity, so in effect there's like our common flu compared to a serious virus, how do they compare?
So one way you can do is something called case fatality rate, which is the number of people who die from the virus out of the number of people who get infected. So if 10 people come down with illness and 1 dies, that's a 10% case fatality rate. 1918 pandemic, worst disease outbreak in history, had a 2% case fatality rate. 1 in 50 people dying, which doesn't sound like a lot until you realize, well, wait a second, you infect 1 billion people. 1 in 50, that's not a good idea. So right now with COVID-19, we're looking at about a 0.4% case fatality rate, which is about 1 in 250 people come down with the disease, succumbing from the disease, mostly concentrated among older populations and those with comorbidities. Whereas something like a bad seasonal flu would have like a 0.1% case fatality rate, 1 to 1,000. So this is like 4 times worse than a bad flu season.
What are some of the most dangerous maybe myths that you've heard when it comes to dealing with pandemics and viruses?
Well, oh my God, there's so many. Injecting yourself with bleach, not a good idea. There was some methanol poisonings in Iran when they took wood alcohol and used it as a hand sanitizer that actually get absorbed into your system. It can lead to blindness and other problems. I mean, the biggest thing is just not, basing one's actions and policies on science, right? If there's ever a time where we really need to figure out what's going on and make decisions based on reality, it's when, hundreds of thousands of people are dying from this disease. But it's ironic that it's kind of gone the other way. People are seem even less likely to believe experts in the science. I mean, people have been doing work in this area for decades and, have the expertise and should really be leading policy instead of, just kind of scratching their heads and wondering why they've been working their entire lives to protect society against pandemics. And then when a pandemic arrives, they're kind of, shuttered in the basement somewhere.
Mm-hmm. So I think that's important to listen to the right people, which is why we appreciate so much you being here with us. So what's your preparedness checklist? Let's say if you say something even worse might be coming. So how would we prepare for that worst?
I've got a checklist. Just like I have my daily dozen and how not to die, my 21 tweaks and how not to die, and how to survive a pandemic. I have a pandemic checklist saying, look, these are all the things we need to get set up. Of course, I originally published this over 10 years ago and was like, make sure you have toilet paper and all that stuff. Nobody listened. But so go through the list. I mean, non-perishable food, things like that. Because, as bad as COVID-19 has been, the electricity is still on, right? Clean tap water is still flowing. Doctors are showing up to work. Food's still being restocked in grocery stores. Well, yeah, but imagine if the risk of dying was, 2 in 5, like a 40% case fatality rate. Then society breaks down completely. And in which case there's, we really have to worry about, just the main, day-to-day sustenance. Then it won't be, am I going to lose my job? Is my family going to lose their lives from the secondary effects? And so I go through and talk about ways that we can, most importantly, prevent that deadliest disease events in the future, but then what to do to ride out the storm.
So what are the measures that you recommend on all levels of society to take to prevent it?
Yeah, so the most important is reforming the food system. So, particularly so swine and bird flu viruses. So we really need to move away from animal agriculture towards these, plant-based meats, plant-based milks, plant-based egg products. Those in the plant-based community have really been leading this fight, whether they knew it or not. A lot of people start eating healthier just for their own personal health, and then realize, just kind of as a little side benefit, oh my God, do you realize the same diet can help the climate crisis? I mean, do you have any idea? And then they're like, wow, that's neat. I was just doing it because, I want to see my grandkids grow up. And now here it is again. It's like, wait a second. Here I was thinking I was just saving the planet and saving my own life. Wait a second. I'm also going to prevent global catastrophe from pandemic disease? It's just the benefits just keep going. It's like Santa's list. It just on and on.
That's amazing. And I love your enthusiasm even after so many years on this topic. So what are some of the developments that also give you the most hope, but or the ones that give you the most anxiety or fear when you look at the developments and our reaction to this current pandemic, which could be deemed a dress rehearsal for what's to come?
Right. Well, the good news for COVID-19 is that, we have over 100 vaccine candidates now, and a few seem to be, we have some early results suggesting that maybe by the second half of next year, we could have access to a safe, effective vaccine. That'd certainly go a long way towards reducing the severity of COVID-19. And other good news in terms of preventing the next pandemic, again, the meat industry itself is kind of retooling itself as a protein industry and saying, look, we don't care where it comes from, right? If we're making money, we'll sell you pea-based burgers just like we'll sell you cow-based burgers. Like, we don't care. In fact, it's easier. We have a more stable supply chain if we're just doing peas instead of feeding peas to cows and then having to go through the whole, it seems so inefficient to do it that way. So they're more than happy to start switching over. People will buy it. But the fact that we're seeing these major producers like KFC, Kentucky Fried Chicken, they're rolling out these plant-based chicken nuggets at dozens of stores in hopes of going national, right? Now, from a personal health standpoint, it would be better to, have a nice, bean burrito or some chickpeas or something. But if you're at KFC, if you're gonna get something, the fact that there's a healthier option, and look, from a pandemic disease standpoint, zero risk.
Yeah, so it really comes down to voting with our plate in that sense. And thank you so much for taking the time to talk to us and share your knowledge with the audience.
Absolutely. Keep up the good work yourself.
We hope you've enjoyed this presentation. A wise man once said, "You make a new life by making new choices." Now, if you know that what you eat matters, if you know that health comes from healthy living, then the time to make new choices is now. And just imagine owning the summit for life. Click the button for more. Maybe you know our stories. Luke and I lost family to cancer, and we wish we would have known sooner what you are learning here today. So please, share the summit, take action, and let's support each other. Thank you. This is Toby and Luke signing off, and we can't wait to see you for the next presentation.